Many states releasing new numbers about the coronavirus and the Black community. Black people are being disproportionately affected by the pandemic, but the toll COVID-19 pandemic is taking another toll on our community, our mental health. Dr. Benson Cooke, a psychology professor at the University of Washington, D.C., is joining us now. Thank you for being with us this evening.
It's a pleasure. Thank you.
Doctor, can you tell us, how does someone know if they have just a normal feeling of sadness at this time, or if maybe it's more?
Well, the thing about depression is that typically you see something that's a little more exaggerated. Feelings of sadness that have no real cause, that typically will last for about 2 weeks or more. Now, with the pandemic, because of the social isolation, and because we've pretty much been quarantined to our homes, people are having to kind of confront the issues that surround more of the routine that they used to have being kind of broken. And in many instances, that causes people to kind of go within a little more than they used to. The social support systems that they used to be able to connect with are not there anymore. Many of the churches that they used to be able to connect with to kind of engage in kind of a spiritual rejuvenation is not there anymore. So in many instances, things that you used to enjoy, you don't enjoy anymore. You find your eating habits changing significantly, more significant weight gain or weight loss. You find significant changes in your sleeping more or sleeping less. You find yourself oftentimes sadder and crying for reasons that you can't really explain. You feel yourself kind of stuck and not really knowing what it is that you can do to kind of get out of that. It's more like a unipolar that would basically occur: depression, major depressive disorder.
What if you're not experiencing that, but you notice it in a loved one, maybe a mother or a brother, somebody else? You see something different. Should you say something to that person?
Yeah, I think it's important to have this conversation. I think it's really interesting that many people who probably didn't spend a whole lot of time with their families during the week are now finding that they're spending more time Monday through Friday, as opposed to the time that they used to spend on Saturday and Sunday. So learning how to have that conversation face to face. We've been so used to using our technology, our cell phone devices to talk, or our tablets to talk, or our computers to talk. Now we have to have that conversation face to face and just really take the time to listen to what it is that people are sharing with you about what's going on. Now, in many instances, we're very concerned about chronic illnesses that may occur at this time, but we also have to be aware of how that's impacting one emotionally. I think we can hear it probably a little more right now in some of the younger folks, some of the children who are basically concerned about the changes that they may be seeing with the emotional affect of the parent, or with some of the more physical concerns that may center around, the increased coughing that they say is part of one of the symptoms, or the fever that may occur, or some of the respiratory concerns that may occur. In this instance, many of those who have personal physicians probably have received messages from them to make a call to them to determine, based upon the symptoms they have, what may be going on. At the same time, you probably can share any emotional concerns that are occurring as well. Those conversations with the physician, coupled with those conversations that take place with loved ones or family members, I think can begin to give one a sense of, this is probably a little more than trying to adjust to a new normal, that I'm really not making the kinds of connections that I used to make, things that I used to remember. I'm not remembering as much as I used to. These, added to the symptoms already shared, may be indicators that one may be experiencing some of the symptoms associated with depression, may be a part of some anxiety disorders as well.
Are there any tips that you can provide for people to sort of help calm them or keep them from going down this road of anxiety?
Well, I think there are a number of things. One of the most important things is to be aware that if one is feeling like life is just not worth living anymore, and they're showing what we would call suicidal ideation, it's important to call a 911 hotline for suicide assistance, to be able to have someone talk them through. Because the hospitals are so overwhelmed, I think while it is important to still call 911, one may want to, if they have insurance, to contact the insurance provider to see what kind of resources are available there. I think in many instances, they'll be able to find that there are specialists that they will be able to call into to get in a consult around what may be going on with them, to get better information.
Oftentimes, there's a stigma associated with getting help or speaking to a mental health professional, that sort of thing. What kind of things can you say to somebody to kind of help them through the process and maybe help them get help, or yourself, even if you're feeling like it's embarrassing?
Yeah, I think it's important to recognize that when you think about stigma for African Americans, there's another piece that's also important, and it centers around cultural mistrust. Many in the African American community are not showing signs of um, paranoia when they think that the medical community has not always been straightforward in the kinds of experimentation that have taken place, and it has resulted in a mistrust that is culturally based. At the same time, as a society, we do have a stigma to symptoms that may be more associated with mental illness. We would be more inclined to talk about, a broken arm, a broken leg, broken back, as opposed to talking about changes in our mood that are significant and affecting how we go about our days. So in that context, I think it's really important to begin to learn as much as you can with the internet. I think there are a lot of medical sites that one can go to get a sense of, are these symptoms associated with something that's a little more serious than just, a general malaise. If that's the case, then again, those other numbers that I indicated one needs to contact, one needs to follow through with to get input from a licensed medical or licensed psychological or counseling professional.
If you perhaps can't afford a healthcare professional or can't afford the healthcare to see a doctor, are tips like deep breathing and meditation, things like that that we always kind of hear about and we kind of think, oh, it just kind of doesn't sound too authentic. Do those things really help in your perspective?
Yes, they can. I think that there are probably a number of things that one needs to be mindful of. One is if one can engage in being in an environment where they can feel supported, that's going to help significantly. So, being in a setting where you have the kind of social support that will help to kind of buttress the weight of the things that adjusting to the changes that we did not see coming. The other piece, I think, is being aware of the importance of nutrition and diet during this period of time. I think there's an inclination when we feel sad to indulge in, the sweets, but in many instances that may not really help to alleviate the problem. It may create other problems. So being mindful of eating more nutritiously in terms of the foods that are high in amino acids, having, instead of fried chicken, grilled chicken, having vegetables that will help to kind of bring the kind of nutritional balance that will be very helpful in helping to support your um, your neurological process in terms of helping to increase, the benefits of the serotonin and norepinephrine. At the same time, exercising plays a real important role in mental health. While the gyms around the country are pretty much closed, I think this calls upon us to be a little inventive in recognizing, again, the importance of walking, recognize the importance of maybe being able to do some stretching exercises. If you're in good enough shape, sit ups and push-ups, things like that. But you want to really be able to get um, your heart rate up, increase your breathing. In many instances, this will help to alleviate some of the anxiety that a person may be feeling. It's not uncommon when I'm talking about lifestyle changes with a client who is going through depression. I talk about the importance of exercise and how it can really help to invigorate one's physical sense and one emotional sense at the same time. Of course, then the meditation is good. It's not uncommon that people who are able to uh, receive support through massaging, that can help. So there are a number of different strategies that help to create a healing that would be very important during this period of time.
Yes, healing is what we all need, and you've given us some wonderful advice. Thank you so much, Dr. Cooke, for joining us this evening.
Okay, you're very welcome. Thank you for the invitation.